വരിഞ്ഞു മുറുക്കി തെയ്യാട്ടം തുടരുന്നു. ചായക്കൂട്ട് വരച്ചു മറച്ചോരപരാധ ചിന്തകളിൽ ഒട്ടുചിലമ്പു വരിഞ്ഞു മുറുക്കി തെയ്യാട്ടം തുടരുന്നു.
I'm sure we'll all agree that we were transported into a different sort of field of emotions and experience. Before I throw open to the audience for any questions and observations, I did want to share a few things and perhaps ask you one or two questions as well. Firstly, we're really delighted that you agreed to screen this so readily here and engage in a discussion with us. I must share that my first interaction with Dr. Baiju was when I wanted to go and witness Theyyam in Kannur, and I reached out to him, and thanks to that I got to experience firsthand both the Vishnumurti and Rakta Chamundi Theyyams during my visit. I have to say, I think this is going to be the beginning of many visits and experiences like this. So just to draw from that, I think the emotional atmosphere and the energy in that space is something perhaps one can only feel. What struck me is that there's so much of deep engagement with the inner world of suffering, and also the suffering that is outside in society and the inequalities in society. So if I were to ask you, when you made this film, what would you hope that trainees and practitioners of psychology and therapists might gain from viewing such a film and thinking about it?
First of all, thank you so much for this wonderful opportunity and wonderful audience, and watching our documentary. Really thank you for that. And I would like to dedicate this entire documentary to the Theyyam performers especially. I think many times what happens is they don't get a chance to watch this. I offered them we will be soon screening it in the place where we showed the entire Theyyam documentary. Answering to the question what Dr. Purnima asked, when we look at the present mental health scenario, probably we can see that even a great percentage of people, even today, when they go through any kind of a mental disturbances or any mental health issues, they will either consult a shaman, mystic, or a traditional healer in any one phase of their treatment or in their phase. Multiple studies from 1970s, even studies conducted in Enhance and other part of India and South Asia, very clearly saying that a good percent of people even going there today. But unfortunately, we look at mental health, well-being, psychology from a very imported sort of scientific understanding, or we using that kind of a metaphor to understand the world of the client. So what this effort is to present and propose how culture matters to us, and what is the possibility of interfacing between culture, psychology, and these kind of indigenous practices. Because when you look at a little bit of the history, we can see that always we, as I mentioned in the documentary, we look down upon these kind of indigenous knowledge, and always we sideline it, because there is, of course, we understand mental health issues from a lens of the colonial legacy, because it came to India, the psychiatry, psychology, the mainstream psychology came through that sort of a space. So this is an attempt for us to engage with this. I'm not saying that this is the solution, but it's much to learn as clinicians, practitioners, researchers. Go to the field and understand, and how much ever we can negotiate with it. What sort of an integration is possible there, and how do we initiate that dialogue? This is what we are trying to do in this documentary, because I visited as a researcher, as an ethnographer, almost 12 years back as a PhD scholar. I visited these places, and that is where I got the interest, because the dynamics of this healing amazed me. When I visited this place as a documentary filmmaker, the visuals were something I could not resist not to document it. You know, as a scriptwriter, I amazed seeing the depth of the stories, because there are 400 plus themes are there in different part of Kerala, North Kerala especially when you look at. And I touched by the field, as rightly Dr. Purnima mentioned, and that is where it started. And I'm pretty sure that the young researchers and scholars and clinicians, we need to engage with these sort of practices and what are they offering, you know. So that is something probably the takeaway for the clinicians and psychologists, I believe. Thank you.
Thank you. I think this really showcases how healing spaces can be many, and for us to understand and engage and dialogue with all of these different spaces where human beings can find healing. Perhaps, I'm not sure how much time we have for a few questions. I'll just wait for an indication. Do we have time? All right, so we have 5 more minutes, please.
I appreciate you, Baiju. I am from North Kerala, but basically born and brought up in Chennai. Since from childhood, I have visited many Theyyam in my village. I appreciate that you picked the common man's God rather than the rich man's God. And in one of the Theyyam was speaking about it. He was staying away from alcohol and non-vegetarian. But I have very recently visited a Kutichathan temple. They offered alcohol to the Kutichathan. And usually the common man doesn't stay away from all these things. He said the common man God is incarnated to the Brahminical God. This is my own question.
Thank you. That's very interesting and very important question, I believe. When you look at the Theyyam, it is not one single form of Theyyam. When you look at Kutichathan, as I mentioned, this Kutichathan is very, very interesting Theyyam, which is a lot of caste hierarchies, dynamics we can find in many Theyyams. Most of the Theyyams are matriarchs, so they murdered in the society, and later they resurrected as God. So we can see that how that kind of a trauma as a community they have gone through. And the most powerful aspect is even they're able to pray to the oppressor. This is something I found advanced empathy, as I mentioned. Even they've gone through all this trauma and they've experienced it, even they kind of pray for them. They were able to hold that intense worries and intense suffering historically they experienced as a community. They're able to hold that. As you rightly mentioned, in some of the forms where we can see that as a practice, the performance, before they go to the performance, there's a 40 days of rituals. Definitely we can look at the cultural, political, social dynamics of that, but they do practice it. From the interaction I understood, even though they offered, that I'm talking about the Vishnumurti Theyyam. The Vishnumurti Theyyam is different, but the Kutichathan Theyyam is different. Or, as you know, many other forms are different. Each forms have its own nature, its own performative way, its own movements, its own rituals associated with that. So it is like definitely, it's a common man's name. Not only, I mean, we can see that that's a common man's name, that they have their own way of representing that divinity itself. I completely agree with that. Thank you.
Thank you, sir. I think I wanted to share an experience related to this. I was training in Chhattisgarh for 2 years, and as you must be knowing that there are communities there which use such practices as faith healing. But I also came across some practices related to burning of skin and etc., which made me feel for the community, and I would always find myself almost criticizing this method and encouraging them to come to doctors. But I feel like I've had a new perspective, and I'm actually wondering if two of these healing practices can coexist, and if we can maybe negotiate or mediate with what is a healthy way of faith healing and what is an unhealthy way as well. So thank you for this.
Thank you for that comment. I think these are two parallel worlds, and most of the time there is no interaction happening between this parallel world. And especially I thank you for the organizers creating a space in such a conference to discuss about it. That itself is an initiation to the interface. If you go to each and every part of India, not only India, all over the world, we can see similar practices. It is different, right? If you go to Himachal Pradesh, if you go to there are many documentaries on that. If you go to Karnataka, you go to Kerala. Recently, there is a very well celebrated movie on Kandara, which is about the Buddha. We also made some documentary long back about it. And the Mata Mantra practices. If you go to the Ukkadagatri temple, if you go to Chatanikara temple in Kerala, if you go to Uttar Pradesh, where the Balaji temple, where Sudhir Kakas work is mainly done, all over the world, different corners of the world, we can find this practice. That means this is very rooted in the cultural psyche of people, which we cannot ignore. So what is happening in our therapy room is every day we are translating these worldview into a common nomenclature, which we need to revisit, and we need to debate what can be learned each other. So that is what I'm trying to present here. Thank you.
Dr. Chalpan.
Yes, congratulations from bringing this piece of work to the audience, especially to us in this forum. It was really enlightening. I have one observation. By looking at the performance, I thought the cognitive and emotional processing is amazing. That is, I would say that is really above normal, that the person is able to communicate, process, dance, psychomotor coordination, complication of movements, and focused attention. All that parameters amazing. That comes with practice. Second thing which I felt is that when we do a therapeutic interventions, our aim is to look at the outcome. That outcome is recovery, healing, and if they are able to do with this format, there's nothing against it. Only thing is, as a mind goes as a clinical psychologist, if severe mental disorders, when they need much more than the cathartic processes, there could be a challenge. So little awareness, I don't know how, with the severe mental disorder scenarios where they can be seeking help, may be much more welcoming. I think you can do that wonderful job again by bringing to their awareness. Wonderful, really. Thank you.
Thank you, ma'am. I just want to say this, what she rightly pointed out, they are practicing nothing extraordinary. It is extraordinary, but it's a potential of human beings. So that is amazing, because if you go to the Theyyam stories, many stories are not documented. Many shamans, not only in Theyyam, when you go to the other practice which is found in the southern part of Karnataka, Siri cult, many of you might be familiar with that. There are 15,000 lines of song which narrate the story of Siri, the goddesses. And this is not documented. Lori Hongo did a work to document it. But they are able to remember these 15,000 lines, which shows their amazing cognitive abilities. And the body movements. Those who are into martial arts, you know this is something, a traditional martial arts called Kalari Baiju. Most of them are very advanced Kalari movements they are able to do. Dances they are able to do, difficult dances they are able to do. They are trained in Mukhashas. I was talking to Purnima before this. They are able to interpret your facial expression. They are able to touch your pulses and understand your body movement. This is not when you look at very empirical evidences, probably we need to establish it. But at the same time, they are skilled trained, I mean, from the childhood to their different phases of life, how well they connected to the stories of their land, stories of the people, and the cultural ethos. So they're able to do it. At the same time, I do agree with that. If a person with this is not, I mean, it's not a solution for a severe mental health problem. I do agree with that. But it is important to understand their worldviews, because that worldview and the client worldview are somewhere it is merging. But sometimes the worldview of the modern psychiatric or psychological practices are in conflict with the worldview of the people from different cultures. That is where we need to initiate this dialogue. Thank you so much.
Thank you, Dr. Baiju. In fact, when Dr. Purnima approached me and said we'll have a documentary, we did deliberate a lot about it, because is it appropriate in a conference like this? But then when I discussed with her, I realized this is going to make a lot of difference, and we agreed to have this. Well, I think like one of the speakers said, let it coexist. I think it should coexist. Why should we look at everything as a mental health issue and send it to the professionals? If there is a community which can facilitate this kind of healing, I think one should be supportive and carry out. I really was very intrigued by your documentary. Thank you very much for sharing with us.
Thank you so much once again for Dr. Purnima, Dr. Mila, and the entire organizers and wonderful audience. Thank you so much.
Thank you, sir, for giving us this opportunity to get transmuted to this surreal experience and treading the path